This is The Catholic Current with Father Robert Mateiga.
Do you think this kind of contagion is going to spread? What might a reasonable man think that all these health professionals who served in the thick of the COVID interruption are now walking away rather than getting the COVID shot?
Well, they're walking away rather than getting the COVID shot because they've done a risk-benefit analysis based on true science, true knowledge of immunology. And they've said to themselves, just as a medical proposition, I don't need this vaccine. I don't want it, and you can't force me to take it.
Praise be Jesus Christ. This is Father Robert Mateiga of the Society of Jesus, your daily host for the Catholic Current, where we bring Christ to the world and the world to Christ. You're listening to us from the Station of the Cross Studios, your local radio station, and the iCatholic Radio mobile app, where we proclaim the fullness of truth with clarity and charity. As always, let's start with prayer. In the name of the Father, Son, and the Holy Spirit. Almighty God, through the intercession of St. Ignatius Loyola, we ask that you pour forth your Holy Spirit upon us, a spirit of discernment, that they might hear your voice and obey your command. In the name of the Father, Son, and the Holy Spirit. Well, friends, you've heard me say many times, I'm not a medical doctor. I don't give medical advice on the air. I have worked in medical ethics for many years. I'm on the National Ethics Committee of the Catholic Medical Association. And as you can imagine, the past year and a half has led to lively conversations about what's going on in science and medicine and how that intersects with politics. I want to talk about a phrase you might not be familiar with called medical authoritarianism. My guest describes herself as a recovering Fortune 500 executive and healthcare professional. Her work can be found at PJ Media, and you can hear her on the weekly Loftus Party podcast with comedian Michael Loftus on KLRN Radio. Stacey Lennox, welcome to the Catholic Current.
Hi, thank you for having me.
Stacey, you recently published an article with the title, How Far Will Medical Authoritarianism Go? Give us your working definition of medical authoritarianism.
When I worked in healthcare as a registered nurse, I took care of a lot of children who had what we call orphan diseases. That means they're very rare and often have a unknown clinical path after a certain point, especially if a child might live longer than would be expected or something along those lines. So I functioned in an environment where we gave off-label medications quite often because there aren't medications approved for a lot of those diseases. And as I functioned in healthcare, that actually was not an unusual thing. And a lot of times new treatments evolve because doctors in a clinical setting begin using something and see success. So this entire pandemic, and it really started for me with the nonsense around hydroxychloroquine, when the science behind why it might work is very well documented. This kind of top-down approach to medicine has turned into something that really interferes with and threatens a physician's ability to practice medicine. The practice of medicine is certainly based on science, but it's also an art. So you're taking a lot of information in about the patient, about research, about current treatments, and you're synthesizing that into what you think is the best for that individual. And so when I see things like, I believe what generated that article is the National Association of Medical Boards telling doctors you can't give vaccine misinformation. Well, okay, what's vaccine misinformation? I listened to the FDA hearings and I listened to Dr. Dorian Fink say that the risks of myocarditis for men under 40 are higher than the risks from COVID. Is that misinformation? I'm quoting an FDA official, but it might make a parent say to their 17-year-old kid entering college, I don't think you should take it. It sounds like that's worse than if you actually got COVID. So they don't define the term, and it's almost, I'm seeing articles today, we need 90% of the population vaccinated in an environment where we're denying natural immunity. I mean, none of this makes any sense, and it's all a very top-down approach, and there's punishment involved. So we've already seen doctors who don't toe the narrative be censored, be investigated. In the case of Dr. Atlas and Dr. Bhattacharya out at Stanford, their licenses are being threatened. Their prescriptions are being overridden by pharmacists. We've just never seen this before, and it's scary.
Friends, I'm speaking with Stacey Lennox of PG Media. We're talking about medical authoritarianism. You know, when I was a child, I was a good but difficult child, and when my mother would say, you know, do X, and I said, why do I have to do X? And her reply, what she thought was sufficient, was because I said so. I never found that persuasive. And in ordinary, you know, garden variety medical authoritarianism, it's the local doctor who just says, you know, do this because I said so. But that's not what we're talking about here, is it? It seems to me that people outside of the doctor-patient relationship are intruding, and so that the doctor, rather than being the great advocate and guardian of the patient, which was the Hippocratic Oath vision in its classical form, the doctor is just the delivery of a service, the terms of which are decided by bureaucrats that neither the patient nor the doctor have met. Is that correct?
That's correct. I mean, it's almost as if Dr. Anthony Fauci is treating us all.
Right, and
which I find absurd.
well, yeah, and it seems to be that you're obliged. It's as if that you're the working supervisor of a medical franchise, and you have to follow the recipe for the secret sauce, or you lose your license to represent the franchise. That I happen to know enough science to know that's not good science, and that's not my understanding of what medicine is.
It shouldn't be, and unfortunately, this interference with what I call the practice of medicine by individual doctors is being interfered with. To me, like I said, this started for me with the debate on hydroxychloroquine because of my background. I do a fair amount of writing on COVID. So I would watch the coronavirus task force meetings for the details, right?
Mm-hmm.
When President Trump mentioned hydroxychloroquine, he also mentioned another drug, remdesivir.
Right.
Only one of those drugs got dragged in the media, had bogus studies published about it. I mean, it was just a ridiculous assault on a very safe, proven medication that if it didn't help, it wasn't going to hurt. And when I went and looked at the science myself, it's what we call a zinc ionophore, which means it helps zinc enter your body cells. And zinc is known to interfere with RNA viral replication, which SARS-CoV-2 is an RNA virus. So just the idea that it was not, and there were documented studies where it stopped SARS-CoV-1 in vitro. So it's not like doctors just decided, hey, let's try this drug. I mean, there's research behind it. It's the same with ivermectin. And it just seems that any readily available, cheap, generic drug that might help as a therapy is getting this media treatment that's just insane.
It seems to me that the practice of medicine has changed over the years. I started teaching medical ethics in 1998, and after a few years, I'd start every lecture with how things have changed since I first started teaching medical ethics. And one of the things I've observed over the years is that medicine has moved away from an art and science primarily for the benefit of the patient to being a commodity and particularly a delivery point for both other commodities that people want the doctor to sell, but also social practices, social engineering that the government wants implemented. Does that seem to be a reasonable analysis, that we've moved away from medicine to benefit the patients to medicine to sell drugs and satisfy bureaucratic dreams?
I definitely think some of our institutions are captured by big pharma. If you look at how clinical trials are studied and the amount of money that the NIH gives to medical research versus the pharmaceutical companies, I mean, it's substantial. I want to say something like 75% of the FDA's clinical trial budget, I think as of about 2018, comes from the pharma industry itself. So I definitely, I'm kind of with Brett Weinstein on that one. I think we've got some institutional capture. The only thing that gave me a brief glimmer of hope was the FDA officials who decided to resign over the booster shot fiasco. But then, you bring these experts in and they have a robust, data-driven conversation. They get all their questions answered. They make a recommendation, and the political appointees just overrule them. I think in that particular case, it was to save face for President Biden because he'd already made this commitment, and we have people so scared of COVID-19 that if that had been rolled back, you would have just sent a certain portion of the population into a panic. It's just, I listen to Dr. Fauci because I have to be able to cover the pandemic. And there's just no good information about what the real risks, especially age-related, are. There's no real.
Stacey, we're coming up on a break, so we can take up the thread in the next segment. Friends, we come back. We're going to continue our conversation with Stacey Lennox of PJ Media. Follow her work there, and you can find her weekly at the Loftus Party podcast with comedian Michael Loftus on KLRN Radio. In the next segment, we're going to be talking about who is following the science, what does that mean, and what happens when you listen to Dr. Fauci for a very long time. After the broadcast today, go to thestationofthecross.com, get our resources list. Keep the conversation going. Christus Mundo, Mundus Christo, bringing Christ to the world and the world to Christ. Let's do it together. We'll be right back. Stay with us.
There's no better way to start your day than with spiritual formation from inspiring priests.
Patriotism is a virtue that was allied to the old virtue of the Greeks and Latin called pietas. Pietas meant love of God, love of neighbor, love of country. And when one goes out, all go out.
That's Sermons for Everyday Living, weekdays from 6 to 7 a.m. Eastern on the Station of the Cross.
You're listening to The Catholic Current with Father Robert Matej from the Station of the Cross Catholic Media Network. Stay connected with the show, our guests and topics, by following the show on Twitter and Gab. Just search for The Catholic Current.
Praise be Jesus Christ. This is Father Robert Matej of the Society of Jesus, your daily host for the Catholic Current, where we bring Christ to the world and the world to Christ. You're listening to us from the Station of the Cross Studios, your local radio station, and the iCatholic Radio mobile app, where we proclaim the fullness of truth with clarity and charity. My guest today is Stacey Lennox of PJ Media. You can hear Stacey on the weekly Loftus Party podcast with comedian Michael Loftus on KLRN Radio. Stacey, we were talking at the end of the last segment. You listen to Dr. Fauci like it's your job, because it is, and God bless you for that patience and perseverance. When they talk about following the science, that always kind of confused me, because science isn't a person or a thing. It's a way of collecting and evaluating data. And it seems to me that a lot of follow the science means follow scientists who are endorsed by people who want to enforce a narrative. So what is it that you're hearing and you're not hearing after you've been listening to Dr. Fauci all this time?
Well, as I said before the break, he's not giving people, and neither does Rochelle Walensky, the director of the CDC, they're not giving people the accurate data about the very obviously age-tranched risks of COVID-19. When you look at it as I believe it was June 1st or July 1st, forgive me, I don't have it in front of me, but earlier this summer, 31% of the deaths with COVID-19 had occurred in nursing homes, and that population makes up 4% of the U.S. population. So that's just one statistic that tells you the median age of death for COVID-19 is actually higher than the average life expectancy. So when you start talking to a population and you're not very clear about those risks, we get all kinds of crazy polling that people think if you get COVID-19, you have a 50% chance of being hospitalized. I mean, it's like the failure to provide detailed information has led to something that I've seen a couple of researchers call a mass hysteria on a global scale. So if you think about something like the Salem witch trials or something like that, mass hysteria used to be a very local phenomenon, but because we're so connected now, they become much wider spread in the population. I mean, just seeing people, you know, go up to their fellow citizens and start screaming at them for not wearing a mask and everything else. And I mean, I come to this from a perspective of, I got COVID-19 very early in the pandemic and I recovered. It was not fun. I was quite ill. But I know how my immune system works and your immune system works. I read up on, and I knew what had happened with SARS and people who recovered from that. These viruses are very similar. It's not really novel. We know about coronaviruses. And I felt very free and fine moving around in public after I recovered, because why wouldn't I? I mean, the only thing that would have been truly stunning about COVID-19 is if you didn't have immunity to it after you recovered.
Right.
I mean, it's just, that would be stunning. But I mean, for them to just repeatedly ignore the things we know to be true, and we've always known to be true, like, we don't quarantine the healthy. That's not something we do. Public health has never done that. Right. And to treat children, I mean, I hear it on television now, and it's something that I just find, I mean, it's a sign of a sick culture in my view. We're literally treating children as mortal dangers to adults, which they're not, based on all of the available data. They very rarely transmit the virus, and they very rarely become seriously ill with it. We're treating them, and now we want to inject them with what is essentially an experimental vaccine to make adults feel better? Like, what society makes children suffer to make adults feel better? I mean, that's
maybe it's
so
society
backwards,
that's comfortable. It could be a society that's comfortable with killing children in the womb for the sake of convenience. I can easily imagine such a society being comfortable injecting children with experimental drugs so adults can feel better. But that's just me. Friends, I'm talking with Stacey Lennox of PJ Media. She is also a registered nurse. We're talking about medical authoritarianism. You know, Stacey, it seems to me when people talk about following the science, they never have in mind the people who have been kicked off of YouTube or banned from Twitter, the scientists who are not fitting in with the narrative. YouTube has just removed countless videos where people are expressing reasonable hesitation regarding the treatment with these particular vaccines. What do you make of the fact that media has become a player now in providing healthcare and healthcare information?
I mean, honestly, most of the anchors I see interviewing, they're just ignorant. I don't know how else to, either they're so invested in propping up the narrative that the administration and Dr. Fauci want to push that they just go along with it, or they literally do not do any homework at all. And, you know, I read scientific research. I listen to scientists. When people tell you to believe the science, that to me is a secular religion that I'm not going to engage in, because science is a process, not an institution. And I think we're getting those two things very, very confused. I shudder every time I hear Dr. Fauci referred to as America's top infectious disease expert. He's not the top infectious disease expert in this country, not by a long stretch. He's the longest-serving government bureaucrat in the health bureaucracy who happens to be an immunologist. I mean, that's it. His opinion is no more valid than anyone else's if you're having a discussion about a novel situation.
Well, I remember as a boy watching Walter Cronkite on the news, and when he'd say, "And that's the way it is, July 17th, 1968," you just believe it because it was Walter Cronkite. It was Uncle Walter. He was a familiar, reassuring face. Now, whether or not that trust was merited, that's another topic for another time. But the idea that I'm supposed to have a sigh of relief because a government bureaucrat is stepping up to the microphone, I don't like that. That offends my sensibilities as an educated person, and also as someone who knows a little something about human nature and human history. As far as I can tell, a lot of these bureaucrats, they've never been elected. They're not accountable to anyone, and yet they have access to the media, to vast sums of money, and people with badges and guns, and they want to tell you and me how to live. That doesn't sit well with me.
Yeah, no, it doesn't sit well with me either. I go back to, was it Ronald Reagan? We're from the government, we're here to help, is like one of the most terrifying phrases you'll ever hear. I look to, I'm a big fan of the Great Barrington Declaration. I listen intently to Martin Kulldorff and Dr. Jay Bhattacharya and Dr. Scott Atlas, because they are saying things that are very consistent with everything I've ever learned about evaluating risk and benefit for a particular therapy or treatment, about how we deal with a public health risk. They're very measured. They're very honest. They'll tell you if they don't know, there's not enough data to say this or whatever. And those are people I listen to and I can respect. I don't necessarily agree with everything they say. Dr. Marty McCary is another one from Johns Hopkins. I don't necessarily agree with everything they say based on what I myself have read, but at least I feel like they're being honest about what they know, what they don't know, and in evaluating the data in a way that's consistent with things we've known for decades, if that makes sense.
No, I understand that. And I think that part of the problem is that, people have busy lives to lead, and they want to be able to establish a relationship with a healthcare provider, someone they can trust. They believe that this person is doing the homework. I'm getting the impression that the past year and a half has really corroded trust people have in their healthcare providers, that maybe, the doctor isn't acting in my best interest, but he's spouting a policy that's being demanded by the hospital or the insurance company or the government. Do you suspect that that the relationship between patient and doctor has been corroded in the past year and a half?
I don't know that the relationship between individuals and their own personal physicians has been as corrupted. I know when I talk to healthcare providers, off the record, because none of them want to go on the record, they will tell me that they are very nervous. So if you have a patient like me, right, who's well-informed, who asks questions and who will ask direct questions to get at information a doctor may not feel comfortable sharing because of the scrutiny and the potential disciplinary actions that are being threatened and other things, it's almost like people are a little bit on their own and have to figure out what they want to know or what they're confused about and ask their doctor, because it's not clear at this point your doctor is always going to bring it up. If you have to kind of understand, I mean, you said you saw a medical practice change. I think a lot of that, I saw it change as well. I became a nurse in 94. So, that was when Hillary wanted to change the whole healthcare system. A lot of it consolidated. A lot of doctors went from independent practitioners to employees of hospitals or hospital systems. And that changes the nature of the system.
Right.
The independent practitioners I know who are still a doctor who owns a practice or several doctors who own a practice feel much more open and in control of what's going on than the doctors and nurses and healthcare providers I know that are attached to a hospital system.
Right. Again, I have found over the years that there is kind of a triangulation now, that rather than the doctor, the classic view of the Hippocratic Oath was the doctor invited a sacred trust from the patient and became the patient's advocate. And now, like I said, the doctor is just the last point in the delivery system of products and of policy. I don't think that's good for the doctor, and I don't think that's good for the patient, and I'm wondering how we might begin to push back on that. Friends, when we come back, we're going to continue our conversation with Stacey Lennox. She writes for PJ Media, and you can hear Stacey on the weekly Loftus Party podcast with comedian Michael Loftus, and also on KLRN Radio. In the next segment, we're going to talk about the intersection between mandates, politics, and science. After the broadcast today, go to thestationofthecross.com, get our resources list, download our audio as podcast. Wherever you can find audio, you can find us. Download the audio, write a 5-star review, follow on your favorite platform. We need to attract the attention of the algorithms so that these conversations get the attention that they deserve. Take this conversation to your family, and together we'll take it around the world. We can do it with you. We certainly cannot do it without you. Friends, we'll be back in just 2 minutes. Please do stay with us.
This is the Catholic Current from the Station of the Cross Catholic Media Network. Catch up on an episode you've missed or share them with your family or friends. The Catholic Current is podcasted wherever you enjoy listening: Apple Podcasts, Google Play, Spotify, Stitcher, TuneIn, and the iCatholic Radio mobile app.
Praise be Jesus Christ. This is Father Robert McTague of the Society of Jesus, your yearly host for the Catholic Current, where we bring Christ to the world and the world to Christ. You're listening to us from the Station of the Cross Studios, your local radio station, and the iCatholic Radio mobile app, where we proclaim the fullness of truth with clarity and charity. We're talking about COVID and medical authoritarianism. My guest is Stacey Lennox. You can find her very good work at PJ Media. You can also hear Stacey on the weekly Loftus Party podcast with comedian Michael Loftus, and also on KLRN Radio. Stacey, you just published an article the other day with Senator Rand Paul interviewing the Secretary of Health and Human Services, Becerra. And just as I preface my remarks by saying I'm not a doctor, I don't give medical advice, I'm not a political partisan either. I'm not an advocate for any party or platform or candidate, and yet it is undeniable that politics is a big part of the COVID event. What's your read of that latest encounter between the senator and the secretary?
Well, I mean, I think both Senator Rand Paul and Senator Ron Johnson have been outstanding advocates for patient rights and the practice of medicine for quite some time now. They're both recovered from COVID themselves, so they have personal experience with it. And when I was watching the discussion between, or the questioning from Rand Paul to Secretary Becerra, it kind of went for me the way I would expect it to go. Rand Paul's a physician. He's an ophthalmologist. He still practices eye surgery in a charity way when he's on congressional breaks. So he's a licensed physician. Who's been obviously reading the data. And I kind of felt a little bit bad for Becerra, because it seems like somebody in his department should have said, these are the questions he's probably going to ask you. I mean, they're obvious, right?
Right.
It was just exceptionally frustrating to me. And again, it's because I watch these things, but I also read a ton of research, not just from the U.S., but from the UK and Israel, where they just have access to better data because their medical records are electronic and other things. And, I it's to the point I no longer trust the data from the CDC. So when I'm hearing Becerra, our teams review all of this and, then we give the best recommendations possible, Rand Paul's like, no, you don't. And if you've read a lot, you're going, yes, Rand Paul is correct. I mean, the one thing that I think this group of scientists and quote unquote experts could do to restore some credibility is just acknowledge natural immunity. Like, why wouldn't you do that?
Well, then you couldn't sell things to people if you did that. I'm just spitballing here, but it would seem to me, there are powers and principalities that have a financial incentive in this, and that's a big part of what concerns me is, why is it the case that you're not tested for natural immunity if you show up to get the vaccine? Is that correct?
That would be correct.
Okay.
And the one study that was done that they refused to peer review or rejected was actually on patients and staff in a nursing home. It was a relatively small study, but what they found was the same waning immunity in people who had recovered and gotten the 2-dose vaccine from Pfizer and the people who'd never had COVID and got the 2-dose vaccine from Pfizer. What you don't find is that waning immunity in people who recover and never get the vaccine, according to Emory University. So you're almost replacing the person's immune response with a less effective immune response if you're injecting recovered patients. If this study held true in a larger population, but they won't study it.
Well, you see, there's a difference between following the science and then refusing to do the science. In ethical theory, that's known as a cultivated ignorance, and you're blameworthy if you do that. I'm not going to look because I might not like the answer. Is blameworthy. So that I'm staggered by that. Friends, I'm speaking with Stacey Lennox with PG Media. We're talking about medical authoritarianism in this segment from the political angle. Stacey, I'm sure you've heard the rallying cry, never let a good crisis go to waste. Is it too cynical to suggest that bureaucrats and politicians, however else they view COVID, see this as a great opportunity to expand their powers? Am I being too jaundiced in suggesting that?
Not at all. I mean, you have to look at the arrogance, and I'll just use her because it's easy. Kathy Hochul, the new governor of New York, masking 2-year-olds. Do you know any 2-year-olds? Like, that's just child abuse. She makes those orders because she has the power to do it. They're not effective. They don't stop the spread. 2-year-olds don't really spread transmit the virus. Right. So they're doing these things because they can, and we let them. Okay. There is no political price in some states for the actions their politicians are taking. Where there is a political price, or where a politician such as my governor Brian Kemp or Governor Ron DeSantis, they brought in a group of experts from a bunch of different specialties, economics, education, healthcare, etc. They went through all of the potential give and take and trade-offs, and then they made decisions that the voters in those states can hold them politically accountable for. It doesn't seem like some of these governors are really making any decisions. They're just following the direct line coming out of Washington, D.C. I mean, who in the current situation where we already had a nursing shortage would decide it's a good idea to mandate vaccines for the people who provided care through the entire pandemic, have likely been exposed to COVID and either had it or had pre-existing immunity, because we know that exists, and say, I don't need a vaccine. I mean, it would be perfectly logical to me to think that most nurses and doctors who've recovered from COVID are like, you're kidding me, right? Why would you then fire those people in the midst of shortages? That just makes no sense unless you're just drunk on your own power.
Well, it's curious to me. I remember the billboards from last year showing pictures of doctors and nurses, and it says, some heroes don't wear capes. Well, okay, fair enough. But now the heroes have become the villain. It's a head scratcher for me. Now you studied science. You've served as a nurse. You understand public health issues. If we are to believe following the science and everyone needs to get vaccinated and we're going to have to live with masks and distancing and hand washing from this day forward, and by the way, we don't need to secure our borders and we don't need to mandate testing or vaccines for people coming into the country without documentation. Can you help me understand how those two narratives fit together? Because I'm having a hard time with it.
They don't.
Okay.
They just don't.
I thought it was just me.
If you look at, there's a group of researchers out there, and the website is called Next Strain, one word. So the next strain of the virus, right? You can actually play their graphic on the maps, and you can watch the variants come up from Central and South America.
Oh.
Now, they mostly get eaten by Delta because Delta is so transmissible, but you can watch, because they're all in different colors, you can watch them coming over the border. They're not in Europe. We don't have the variants from Africa yet, but we've had all the ones from Central and South America enter the country.
Well, that's alarming, and we'll certainly link to that in our show notes as well. I'm also thinking, too, where, politicians were telling us that, masks save lives, et cetera, and they seem to be kind of yucking it up with their counterparts, and then the cameras come out, and then the masks come on. So I'm are we seeing a fair bit of theater among our politicians? Are they just bad scientists, or are they playing the people they're supposed to serve?
Absolutely. This is a respiratory virus. It's extremely tiny. As a registered nurse, I wore masks. I wore PPE. The reason you see healthcare providers wearing PPE, like masks and gowns and gloves and eye shields, is to prevent the splashing of blood and body fluids. Mm-hmm. There's no nurse that's wearing a paper mask in a hospital who would tell you that would prevent them from getting the flu or any other respiratory virus. That's just ridiculous. Cloth, useless.
So the idea that you should wear a mask as a sign of courtesy to your neighbor, because you're not so much protecting yourself but protecting your neighbor from you, is that the way that you were taught about masks in nursing school?
No, even if a patient had a respiratory virus, if I was wearing a mask when I went into the room, we did not require a patient to mask. It's one barrier between two people is sufficient. And in reality, in a hospital setting, the way people with serious respiratory viruses are controlled, like tuberculosis or something along those lines, there's negative and positive pressure rooms. Mm-hmm. So it's done through the ventilation and circulation system for anything that's aerosolized. It's not a PPE-driven protection.
So it seems to me there is this seems to be a great lab experiment in social control and manipulation. I remember seeing a meme where it looked like some ordinary person, for lack of a better term, is talking to some folks who are clearly Amish, and she says behind her mask to these bearded men, "Well, why don't you have COVID?" And they say, "Well, because we don't have a television." So there is there
I saw that too.
Yeah. Do you get the sense that whatever the sign, and yes, COVID is a real thing, and yes, people really do die, and I'm not diminishing that at all, but it seems to me that what we're witnessing on a much grander scale is an experiment in social control through media and government. What are your thoughts on that suggestion?
There's actually a paper out on the NIH website, and it is written by a social scientist named Albert D Biderman, and it was done in the 50s, I think, and he was looking at how the communists elicit false confessions from Air Force prisoners of war, and he actually put that into a set of steps as to how you get that level of control over a person. it's pretty similar to what we've seen for the last year and a half.
Oh, that's disturbing. that's
I don't know if it's intentional or if it's just the way the world works. But if you think about it, there was a couple general methods: isolation, monopolization of perception, induced debilitation or exhaustion, threats. I mean, we're seeing that now for the unvaccinated, of course.
Sure.
Occasional indulgences, so telling people they're doing the right thing, demonstrating omnipotence or omniscience, degradation, enforcing trivial demands.
Well, that sounds really familiar. It sounds like what we've all been living for the last year and a half, and I know that when these things take place on a grand scale, I mean, the 20th century gives us very vivid and bloody lessons on what happens when people allow themselves to be manipulated. Friends, we come back. We're going to continue our conversation with Stacey Lennox of PJ Media. We're talking about medical authoritarianism in the present context. The next time, we're going to ask about what can ordinary people do next. Do we just have to sit by and watch the show unfold? I don't think so. After the broadcast today, go to thestationofthecross.com, get our resources list, download our audio as podcast. Be part of the conversation. Follow what we're following by following us on Gab. That's gab.com. Our channel is The Catholic Current. Everything you need to take this conversation to your family and friends we give to you. Together, let's take it around the world. We can do it together. We cannot do it without you. We'll be back in just 2 minutes. Please do stay with us. This is Jesuit Father Robert McTague, your daily host of The Catholic Current. Join me on Friday at 5 p.m. Eastern for another round of Let's Talk About This. We'll be talking about the New York governor's announcement that the COVID vaccine is a gift from God. We'll wrap up with weekend readiness, reviewing the headlines of the week in light of Sunday scriptures, so you'll be all prayed up for Sunday Mass. That's Friday at 5 p.m. Eastern on The Catholic Current, coming to you from the Station of the Cross and the iCatholic Radio mobile app.
After today's broadcast, go to the Catholic Current show page on thestationofthecross.com for info on today's guests, the show resource links, and to sign up for our weekly email of upcoming shows.
Praise be Jesus Christ. This is Father Robert McTague of the Society of Jesus, your daily host for the Catholic Current, where we bring Christ to the world and the world to Christ. You're listening to us from the Station of the Cross Studios, your local radio station, and the iCatholic Radio mobile app, where we proclaim the fullness of truth with clarity and charity, talking about medical authoritarianism. Our guest today is Stacey Lennox. She is a nurse, recovering Fortune 500 executive. Her work can be found at PJ Media, and you can hear Stacey on the weekly Loftus Party podcast with comedian Michael Loftus, and also on KLRN Radio. Stacey, I can't help but think of the little quip that Mark Twain made. Everyone complains about the weather, but no one does anything about it. I think that the intersection between science and politics that we've seen during the COVID crisis hasn't really been good for people or for our republic. So what do we do next? There are some people who say, if you just say politics is the problem, vote harder. That seems to be counterintuitive. I don't want people to do nothing. You've been following this very closely. You must be exasperated on times. What can ordinary people do besides hold on and hope it stops eventually?
Well, I think one of the things you can do is look for people in your local area and look for politicians that actually looked at all of the data and are making decisions. They're not just following the herd. We need more of those people, not less. So we need more Rand Pauls, we need more Ron Johnsons, we need more Ron DeSantis's. And they're not all Republicans. There's some Democrats that are doing it too. So, you really have to look for the people that are taking a thinking approach to this rather than a non-thinking approach.
Right.
I think that's number one. I think number two really start to listen to the voices you don't hear on television, right? I will just tell you right now, Dr. Lena Wen, who is on CNN all the time, is one of the dumbest people I've ever listened to. She's just dumb. Sorry. Don't listen to her anymore. Look for interviews with Dr. Bhattacharya, a renowned Stanford epidemiologist, right? Look for interviews with Martin Kulldorff. He invented the VAERS system. These people have all been in the health bureaucracy. They've worked with the FDA. They are not kooks. They are not one-offs. Listen to their opinion, then listen to the other opinions, and then make your own decisions, right? You have to, you kind of have to take control, in my mind, of this for your own mental health, right? So you need all of the information to do that. And I know Scott Atlas is putting out a book. That's coming out in November. You really have to listen to more than just the people they allow to speak, if that makes sense.
Right. No, I think if you only got your news from mainstream media and you only took on board what the approved talking heads had to say, you'd be exhausted and panicked just constantly, and that's not healthy for anyone. I try to stay on top of this because of my work in media. I mean, you even more so. God bless you. All those hours of listening to Dr. Fauci. I don't know that I have that kind of perseverance and endurance to do that. So my hat goes off to you for that. What do you think that the mental health toll has been on our society? I mean, I've read studies that there's been spikes in depression, in substance abuse, in suicide, and that doesn't seem to be factored into a lot of policy pronouncements. Do you think that the COVID response, whatever it's done to COVID, has had really ugly side effects that we haven't come to terms with yet?
Oh, I think I think some of the education gaps we're going to be living with for a generation. I mean, when you look at how this pandemic and the mitigation steps that were taken impacted some of the most vulnerable populations among us, especially poor children, it's unconscionable, number one. We're going to see a lot of other health effects from the pandemic as well. You can't just run your health system worried about one type of illness. We have people who've missed preventative testing. We're going to end up diagnosing cancers that are much more advanced than they would have been. There's going to be a lot from this. And I think what'll be interesting to see, I mean, again, I live in Georgia. My town has been 100% open since last June. We don't wear masks. I mean, you can if you want to, but you don't have to. Even Walmart here couldn't keep them on us until the CDC said we could take them off. I think our kids went back to school last August. My town had the first high school football game in the country. I think it'll be real interesting to see the differences between the kids who weathered the pandemic somewhere like Georgia or Florida versus kids who were kept out of school for a year and weathered it in some place like New York or California. I think you're going to see a big difference in mental health outcomes. I know you're going to see a difference in educational outcomes. I mean, we kind of have a couple different laboratories here. I think the future will tell us we did almost everything exactly wrong.
Well, I have friends who've taught in the public school system, and almost without exception, they refer to the past year as a complete loss. A lot of them were never trained to how to teach via Zoom. No one talked about it. Is it really good to have kids stuck in front of a screen for hours and hours at a time? And there was just a sense of, just get through the day, just keep faking it, and don't worry about the outcome. And that summarizes what a lot of my friends in education said that they were told by their superiors, that just log on and talk into the camera and don't expect that anyone is listening. and then just kind of soldier on from there. I think that's going to have a long-term cost as well. What do you see going ahead? Dr. Fauci has been talking about this could be a very difficult winter. Don't get your hopes up for Christmas. Is he just a doomsayer, or is he onto something?
I think he's a doomsayer as far as COVID goes. Again, you're talking to somebody who lives in a state where we haven't missed a single holiday. So,
okay,
yeah, we just didn't. We went back to we started living with COVID when our governor opened the state. So, I think what we should really be concerned about is after a year in some places, especially in the Northeast, of masking people, them rebreathing their own CO2, and not, I mean, part of how your immune system keeps itself healthy is by contacting your environment. I mean, I think if we went into the kitchens and got a hold of the cell phones of some of these real now germaphobes and cultured them, they may just cover themselves in plastic. I mean, you contact thousands of viruses and bacteria every single day in everything you do.
Right. And
so
the idea
that's how your immune system works out. So the UK has actually warned about a immune deficit in children, and that normal seasonal illnesses like the flu, like RSV, might be worse for them because their immune systems are impaired now.
Stacey Lennox, thank you for being a very fine guest. I'm so impressed with your work. I hope we can have another conversation on the air again soon.
Absolutely. I enjoyed it. Thank you very much.
This is Jesuit Father Robert McTeigue. Join us tomorrow on the Catholic Current. We'll be talking with scholar Noah Williams from the Manhattan Institute. We're going to be talking about how reducing unemployment benefits reduced unemployment. You heard that right. After the broadcast today, go to thestationofthecross.com, get our resources list, download our audio as podcast. Through the intercession of Our Lady of Mount Carmel, may God bless you, Father, Son, and Holy Spirit. Go in peace, and please pray for me.
Thank you for listening to this podcast brought to you by thestationofthecross.com, a listener-funded nonprofit organization. Please prayerfully consider donating at thestationofthecross.com by calling 1-877-888-6279 or through our free iCatholic Radio mobile app.